How's it going, guys? Medium difficulty question, cardiopulmonary, steps 1 and 2, 23-year-old woman. Blood pressure 2 weeks ago, 160 on 90. Today, 160 on 95. Physical exam shows a left carotid bruit. Cardiopulmonary exam, normal. No significant past medical history or family history. We have this renal angiogram here, which is our string of beads appearance, very buzzy for fibromuscular dysplasia and USMLE. We'll talk about it as we move through. What's most likely we see in this patient? Choice A, atherosclerosis of the abdominal aorta and left femoral artery. Both wrong fucking answers, okay? It's not an atherosclerosis condition. When we talk about the notion of renal artery stenosis, if you say that, it implies atherosclerosis of the renal arteries, patient over 50, usually risk factors, diabetes, smoking, hypertension. But if you have a woman, 20s to 40s, I've seen one vignette where it's 50s, but usually woman 20s to 40s, and they can get a tunica media abnormality that results in this string of pearls appearance called fibromuscular dysplasia. We don't call this renal artery stenosis per se, all right? But it's not related to atherosclerosis. Wrong fucking answer. Choice C, increased urinary bicarb. A little bit tricky, wrong fucking answer. So if you've got an issue with the renal arteries, you could maybe make the assumption that you would have increased RAS, and that would lead to increased aldosterone, where what's aldosterone going to do? It's going to reabsorb sodium out of the urine. It's going to secrete potassium into the urine. It's going to secrete protons into the urine. So you're making the urine more acidic. If the urine is more acidic, then it's going to be less basic, which means you would have decreased urinary bicarbonate. Choice C, wrong fucking answer. Choice D, serum bicarbonate, 21, wrong fucking answer. As we just harped on with choice C here, if anything, we'd have increased RAS and theoretically a metabolic alkalosis where serum bicarb goes up because we're secreting protons distally. Normal range 22 to 28, so we could expect EG 28 or greater, not 21, wrong fucking answer. Choice C, diagnosis of exclusion, or answer choice of exclusion here. Normal serum creatinine, 0.7 to 1.2. This is the correct answer. Patients with fibromuscular dysplasia often have normal renal function tests. Creatinine and BUN need not be elevated. I've seen this on NBME questions. That's why I'm making a question on it here. And I've seen it confuse students. So like, but the renal function tests are normal. You're right, they're normal and they don't have to be elevated. And the other thing to point out is you say, what's going on with the carotid bruit here? I've seen this also in NBME questions. So fibromuscular dysplasia, it doesn't only affect the renal arteries. You can get other vessels involved, such as the carotids. Okay, so it's something to be aware of. And if you think choice C is weird, you say, well, we conjectured about the possibility of RAS being up, which is why C is wrong. But even if RAS is elevated, your kidney can compensate to a degree and you can still maintain normal renal function tests. So in this case, it's a pass level diagnosis. We throw in some tricky things like the carotid bruit. Some of you probably have never heard of that before, so you're thinking it was atherosclerosis. Not. She's way too young. There's no family history of dyslipidemia. And this renal angiogram, the string of pearls, very buzzy. And then we just eliminate the other answers to get there. You got to know a little bit of endocrine here. Choice C, correct answer. You know the deal. I'm going to make more content. I'm going to stop screaming. Appreciate your time. That's it.